Hi, my name is Camila. I'm a postdoc in the Ljubljana lab in the University of Copenhagen.
Hello, my name is Marco. I'm the president of European Liver Patient Association. Camila, so what is your work about? What are you doing?
So right now we are trying to help in the early detection of ACLF. So when patients go to clinics, they can develop ACLF in some period of time. So we want to detect the patients that are actually going to develop acute decompensation, and then we can see how we can treat them better.
So if you just repeat once again, ACLF is acute.
Is acute liver failure.
Excellent. So who can develop that? Is that like very common? Can everybody develop that or just not so common?
So in liver disease, there are some patients that never develop the acute decompensation failure, like the failure of the liver. Some of the patients are stable, so they have the liver disease, but they are stable and they can have a life expectation of around 12 years. Other patients do develop some complications like bleeding or some infections, and the life expectation is just 2 years. But other patients get this acute liver failure, and that is more complicated.
But you try to test if you can predict if someone will develop this condition?
Yes. So some patients go into clinics, and we want to see if we can detect which patients are going to develop the ACLF before they do it. So we can, like the clinicians, can treat them different and see if they can maybe prevent it.
So how do you do that? You have an interview or you draw some blood, or how do you get this
So
information?
far, we are trying to analyze different kind of samples to see with which one we can have more information. So we have stool samples, urine, plasma, and also mucosa samples. So we run a bunch of different biological tests, and we have some molecules. And then my job is trying to see with which one of these molecules we can better predict which patients are going to develop the disease.
So do you already see how is this going on with which you can predict?
Yes, we are working on that, and we have some preliminary results. So with one of the molecules are metabolites, we can see that we can actually predict some if the patient is gonna develop the ACLF. But we are working in a kind of a small cohort. We have to validate our results in an external cohort.
So what are then the next steps of your research?
So the next steps will be now try to find external cohorts where we can validate the markers that we found to see if we can predict as well as we did in the cohort that we have now. And once we have that, we can go deeply and study the markers that we found and see how they explain the disease development. So more for the biological point of view.
Thank you very much.
Mm-hmm.